This is Addressing Social Isolation in Older Adults, created and presented by Group 1 for Nursing 321, Gerontological Nursing and End-of-Life Care at the University of North Carolina at Wilmington. A recent estimate considers 24% of older adults aged 65 and above as socially isolated. In addition, estimates from the United States show that more than 40% of older adults are lonely. But what is social isolation and how does it relate to loneliness? Social isolation is an objectively limited or lack of social contact with others. This can be characterized by a shortage in one's social contacts and network size. Loneliness refers to perceived social isolation, or a subjective, unpleasant feeling that results from a significant mismatch between one's actual and desired social relationships. Despite their similarities, loneliness and social isolation are not the same. Loneliness is a subjective, emotional feeling, whereas social isolation describes an objective and a quantifiable aspect of social relationships. As nurses, we are all familiar with the SBAR reporting tool. This presentation will discuss this topic using SBAR as a guide to evaluate social isolation and loneliness in the older adult population. The situation in this scenario will explore adverse effects of social isolation and how it negatively impacts the older adult population. The background will address risk factors to be on the lookout for that can indicate social isolation or loneliness in this group. The assessment will introduce screening tools that are useful for detection of social isolation. And finally, the recommendation slide will address interventions to aid in reducing isolation and loneliness in the older adult population.
Social isolation is something that causes more harm than I think most people realize, especially in our elderly population. As humans, we strive for that connection and that intimacy with other humans, and we are sensitized and raised to do so from a very young age. We're taught how to interact and communicate with our fellow friends from a young age. We're taught right and wrong. We're taught how to share. We're taught how to coexist and interact with people from the get-go. So if people go long periods of time without that interaction, it leads to social isolation and loneliness, which can also lead to a whole other level of problems, medically and emotionally. As we age, there's a multitude of reasons that can cause social isolation and loneliness. Just a few of those include the loss of a spouse or a partner. It can include separating or moving from family or friends. So if you have elderly people whose family has moved away or children moved out to college, things like that. It could mean loss of mobility that's required us to become isolated or stay in one spot for too long. It could be a lack of transportation. So if there's visual changes or cognitive impairments that have required us to, or the elderly, to lose driver's license, then you have to rely on other people. It could be retirement from work, therefore not having things to be involved in as much. So there's been several studies done on social isolation and loneliness, trying to correlate the isolation with medical diseases and the negative effects of it. John T. Cassiopu, he has a PhD. He was the former director of the Center for Cognitive and Social Neuroscience at the University of Chicago. He piloted a study that started to focus on the correlation of social isolation in the elderly to physical and mental illnesses. There's other studies that have been done, like Steve Cole. He's the director of Social Genomics Core Laboratory at the University of California in LA. His research goes as deep as to figure out how loneliness affects your mind and your body and ways to combat that and to have interventions to fight the loneliness. Dr. Cole specifically said that loneliness acts as a fertilizer for other diseases. So elderly who are experiencing social isolation and loneliness, they are shown to have weaker immune systems per Dr. Cole, therefore a breeding ground for all other diseases. Some specific examples of some of these studies are showing that there is a direct link with the isolation to high blood pressure, heart disease, obesity, mental disorders such as anxiety, depression, there's cognitive decline, Alzheimer's, or even death. There has been some cases that have been shown that there has been suicide attempts related to the social isolation and loneliness that these people experience. So I think our elderly population, a lot of times people think about how good of a life they've had, the stories they must have to tell, and how they're wise beyond their years. All of those things are true, but what people tend to forget is the negative aspects that happen as we get older, especially considering the isolation aspect of things.
There are a number of risk factors that need to be considered when discussing social isolation of the aging adult. Largely, these risk factors can be divided into two categories: physiologic and socioeconomic. The physiologic factors are made up of physiologic changes. This could include diminishing vision, hearing, or the progression of disease processes such as heart disease, COPD, arthritis, dementia, or other limiting disease processes. Diminished senses such as hearing and vision limit the older adult's ability to communicate with those around them, whereas the progression of chronic illnesses such as heart disease or COPD or arthritis will limit the aging adult's ability to ambulate and get to where they need to go to socialize. Finally, disease processes such as dementia or Alzheimer's can lead to psychological impairment of the older adult. In addition to the physiologic factors, there is a large amount of socioeconomic factors that play into the isolation of the aging adult. Examples of these include their income. Many aging adults are on a fixed or limited income. This limits their ability to seek out social events or other activities where there is a cost associated with them. In addition to their income, many aging adults are beginning to experience changes in their social support system, whether that be from their family or their friend group. Aging adults experience changes as friends begin to have declines in their own health or ultimately pass away, as well as oftentimes facing the decline in their own health and facing nursing home and the challenges that come with visiting loved ones in those facilities. Another consideration would be socioeconomic groups that we know to be predisposed to social challenges, such as the LGBT community or immigrants. While there is limited published data on this, we do know the LGBT community and immigrants are more likely to face social isolation as they age. One final factor that needs to be considered would be the geographic setting in which the aging adult lives in. Rural communities offer less transportation options, less internet, limited healthcare, as well as limited social spaces such as gyms or other athletic events, limiting the options that the aging adult would have to seek social interaction.
Nursing assessments for social isolation in our older adult patients can be performed using tools that measure subjective feelings of loneliness or objective instances of social participation. There are quite a few published scales to measure social isolation. We will be looking at 4 of the most common. These can be used obviously in research, but also in clinical settings. The first is the Lubin Social Network Scale. It's looking at the patient's family and friends and takes about 5 to 10 minutes for them to complete. There's an abbreviated version that has 6 questions that's commonly used, and an expanded version as well. And these differences were just developed in order to meet different clinician and patient needs. There are 3 questions about family members and 3 questions about friends. They're asked in the same way. So how many relatives or friends do you see or hear from at least once a month? How many relatives or friends do you feel at ease with that you can talk to about private matters? The higher the score the patient has, the larger their social network is. Next is the de Jong Loneliness Scale. There are 6 statements, 3 that measure emotional loneliness and 3 that measure social loneliness. And the patients respond with either yes, more or less, or no. So an example of an emotional loneliness statement is, I experience a general sense of emptiness. An example of a social loneliness statement is, there are plenty of people I can rely on when I have problems. For this scale, a higher score indicates higher loneliness. The next is the Revised Social Support Questionnaire. And this measurement is identifying the specific people a patient turns to for different situations. So for example, who can you really count on to help you feel more relaxed when you are under pressure? Or who accepts you totally, including both your worst and your best points? Each of these questions is followed up with a scale regarding how satisfied the patient is with their social support. Finally is the Duke Social Support Index. This is a 10-item assessment. It has 2 subsections, one being that objective social interaction we talked about, and one being subjective social satisfaction. An example social interaction question is, what is the number of times in the past week you talked with friends on the phone? And a social support question example is, do you feel useful to your family and friends?
Next, we will discuss recommendations to alleviate social isolation in older adults. As healthcare professionals, it is important for us to follow these 4 easy steps for us to alleviate the issues that come with the burden of social isolation among older adults. These steps include identifying why, teaching modernized social skills, counseling, and awareness education. Now we will go further in detail within each one. Step 1, identifying why. It is essential to first identify the causes of social isolation before treatment can be given. Foca et al. 2020. Identifying the underlying reason can help create an effective care plan. According to the National Academics of Science, Engineering, and Medicine 2020, healthcare professionals should be aware if a patient is having difficulty hearing and communicating in social settings. This issue can be simply resolved with the use of hearing aids in order to improve the patient's communication ability in social situations. Step 2, teaching modernized social skills. Teaching modernized social skills has been shown by Foca et al. To be critical in today's society. Often older adults feel left out because of technology, which also plays a significant role in social interactions that are happening today. Educating these individuals on how to use technology to interact with their loved ones and friends has been shown to decrease social isolation among these older adults. Step 3, Canceling. FOCA et al. 2020 emphasizes the significance for individuals being canceled that are experiencing social isolation. With COVID-19, many individuals feel that they are unable to be around other people or may even fear doing so. According to the National Council of Aging 2023, canceling can be conducted through technology. This is a great resource for these individuals to be able to communicate with a counselor without having to be risky and exposing themselves to illnesses. Step 4, Awareness Education. Lastly, educating patients on the importance of being aware of social isolation is crucial. If older adults are aware of their risk factors and feel comfortable communicating their concerns to healthcare professionals, they are more likely to have better outcomes and less likely to experience any adverse outcomes associated with social isolation. FOCA et al. 2020. In conclusion, as healthcare professionals, it is important for us to follow these 4 easy steps to alleviate social isolation in older adults. Thank you for watching our presentation on social isolation in older adults. It is crucial as healthcare professionals to use the acronym SBAR to tackle this issue: Situation, Background, Assessment, and Recommendation. Thank you again for watching our presentation, and below are our resources.